The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. We are here for the next episode of TMD Demystified. My name is Tony Urbanek. Today, the title is of our episode. The title of our episode is Treating TMD is Easy, emphasis on easy, when you understand the cause. Treating TMD is easy when you understand the cause. Now, I've gone over this many times, but we're going to take a little different tact, as in sailing ship. We're going to tack a little differently on this particular title. And I do understand, because of my extensive experience, to me it sounds easy. And to you, if you're through the skeptical part, and may not be through that skeptical part, but even if you are through the skeptical part, you may not consider it really easy to treat TMD with our device and protocol, the Urbanek Device and Protocol. I understand that, because you don't have the vast experience that I and my associate has, and some of our other network providers have. But the truth is, after treating well over, I don't know exact number, well over 4,000 people, we're probably getting up near 5,000 successfully treated non-surgical TMD patients within the past 8 years or so. It actually is easy. Now, you don't have to get up to 5,000 people to make it easy. It comes long before that, and actually it's a lot of fun. But here's the nuts and bolts of it. We have figured out that the primary cause of all of the symptoms is chronic inflammation within the joint. The chronic inflammation directly drives each and every one of those symptoms, and I've described that process endlessly. I'm not going to do it again. Please refer to prior episodes. But that just is fact. And so once that fact and how that comes to play, the science behind that, the anatomy, physiology, which is quite simple, once you understand that part of it, how chronic inflammation drives all the symptoms, then it's easy to understand how unloading the joint over a period of time, which is the clinical part of this, using a very simple device that separates the back teeth, that's the clinical part of it. And there's a little bit more to it, having to do with vertical dimension and forces, but how that little device, which unloads the posterior teeth, will then decrease chronic inflammation with the help of a protocol. And so it's a two-part treatment, device and protocol, because you can't just put the device in when you want to, or when it hurts, or when you have symptoms, because diminishing chronic inflammation doesn't work at the drop of a hat. So you got to follow the protocol. But the cause is known. That is chronic inflammation and damage to the joint due to bruxism, acute trauma, and functional malocclusion causes chronic inflammation. Makes no difference what the joint looks like, makes no difference how much damage is done, how much bone loss is done, Makes no difference. It's all about the chronic inflammation. And then you apply the device, the clinical treatment with the device using the protocol. How the device works is well known. The protocol is well known, 24/7 for 2 months, nighttime only the rest of your life. It is well known that that protocol works extremely well. There are almost no exceptions. There are a few variations to that protocol, and the variations are also very simple. When the patient uses the device, getting a good result, but then goes to the dentist and opens widely for 2 hours to get a crown prep done and a crown, it will stir up the chronic inflammation. Or when they yell at the dog, hopefully they don't yell at their husband or sing in church. It is well known that that will stimulate the chronic inflammation, at which point thereafter they may have some increase in symptoms, of which the result is put the device in your mouth more often during the day. So some patients, actually we now know 15% of the patients find after they get through the 24/7 and in nighttime, some of them find out they need to wear it more during the day on occasion, and some patients figure out they know when to put it in their mouth, which I hear very frequently here in the South. I figure it out when I'm in traffic. I figure it out when I'm sitting on the computer. I put this thing in my mouth. So 15% of the patients need to wear it a little more or want to wear it a little bit more, and 85% of the patients who follow the protocol, all they have to do is keep it in every night or when they sleep, when they nap. And that has worked out really well, and it has been proven statistically, independently, by independent university study, that the results are as I say they are. Very successful, 85 to 95% success rate using that device and protocol. So treating TMD is easy when you understand the cause, when you apply the device, when you apply the protocol. Those are all knowns. Those have been worked out. They have been proven objectively and subjectively, analytically and statistically. So here's the take on this particular episode, and that is all those things are known extremely well. But what isn't known is patient compliance. And when we find, and this is consistent, that I see, my associates see, and the other doctors who are already in the network of doctors using the device and protocol, what they see is the variable, the real variable is whether or not and what kind of patient compliance can be achieved. And as I see almost daily when I treat patients myself, had two examples yesterday that little different variations. I'll describe them in a moment, but patients who would come in at one point or another and say they're not getting the result that they expected, that I expected, at which point it always boils down to patient compliance. The first example that happened yesterday was an older woman, middle-aged woman who came in with her husband, who had only had the device in for only 3 weeks and said she was getting no response. And on questioning her, she admitted that she wasn't wearing the device, except just a little bit, instead of 24/7 to begin with. It's like, what can you do about that? Be patient, explain how the device works, explain the importance of the protocol. You can't just put it in your mouth and expect the pain to go away. It takes time for the inflammation to die down, which I'm sure varies between patients. Some patients get a relatively sooner decrease in symptoms rather than later. Some people have the chronic inflammation decrease over a longer period of time. But that is why the 24/7 to begin with is so important. But again, lack of patient compliance, and it wasn't because lack of trying, lack on my part at the beginning in the consultation to explain to the patients, because I'm very consistent. I know that I explain in each and every patient how it works, why protocol is so important to do. And the other patient, and this gets a little more technical, was a patient, a younger woman who came in, and again, she had just started the using the device and had it in only for 5 days, and just complained bitterly that it actually increased pain for her. And that after 5 days, she took it out. And as she described the fact that it was painful, I watched her literally. I had her put the device in her mouth, and as she described for me, because I put it in her mouth and asked where it hurts and how it hurts, I watched her protrude her mandible as she spoke with the thing in her mouth, which she didn't do when it was out of her mouth. When the device was in her mouth, she had a habit of literally, as she spoke, pushing her teeth forward over the surfaces of the device itself. And of course, all that does is distract the condyle out of the fossa, which by itself will create chronic inflammation. Functional malocclusion, that's what functional malocclusion is. Do that to any joint, and sooner or later it will begin to be inflamed and it will hurt. Knee, hip, elbow, TMJ. But she didn't follow the protocol, and that's a different story. And then protrusive habits, but that was a protrusive habit. I think we got it solved. She recognized, oh, I see what I'm doing. I think I can stop doing that. So we'll see in a month when she comes back, but definitely, didn't follow the protocol of just putting it in the mouth and leaving it alone. Don't fool with it. Don't fiddle with it. Don't put your tongue there. Certainly don't protrude your mandible over it. And you can expect to get the result. So, the point of this episode, driving it home from the aspect of the actual cause of all the symptoms is known. It is not unknown. It has nothing to do with long-term muscle motion, the theory that if you overuse a muscle, it will create trismus. No, the trismus is created by the inflammation in the joint, sending autonomic signal to the brainstem, which in turn sends autonomic signal to the muscle to tighten up, but not always the same muscle, not always the same side of the face, not always in the face, sometimes in the neck, sometimes in the shoulder. But that is the actual mechanism, not the myofascial pain dysfunction syndrome theory. That is a theory. But the pathophysiology has been proven not just with the temporomandibular joint, but with other joints in the body. Tennis elbow has the same mechanism. Tennis elbow and TMD is the same mechanism. Tennis elbow and TMD is the same disease. Tennis elbow is inflammation of the lateral epicondyle, sends an autonomic signal to the brainstem. The brainstem says, I see you're inflamed. Don't move the elbow. Tighten the muscles that move the elbow. Tighten up. Where are those muscles located? In the forearm. What do patients complain about with tennis elbow? Not inflammation there. They complain of pain in their forearm. Same issue, same pathology as the temporomandibular joint. Now, you can push on the temporomandibular joint, you can push on the lateral epicondyle when it's inflamed, and the patient will say, ouch, it hurts. And all you're proving there is that the joint's inflamed. But the primary complaints of TMD and tennis elbow are similar. They're in muscles that are quite distant from the source of inflammation. That is known. That is proven. The best way to decrease chronic inflammation in a joint is to unload the joint. That is known, that is proven. A set of crutches on the knee for the knee or a sling for tennis elbow are well-known substantial solutions for pain in the knee or the elbow. Now, you may not want to walk on crutches your entire life, or you definitely don't want to walk around with a sling on your elbow, but if you are on crutches long enough and you are in a sling long enough, the chronic inflammation in that affected joint will decrease to the point where the symptoms go away. And that's the exact same thing that happens with TMD. So the clinical treatment is known, the protocol, how best to use the device. I guess you could have the protocol for how long you'd want to have the patient in a sling, or how long you'd want a patient on a set of crutches before the inflammation dies down. Of course, if you're going to continue to overuse the knee, or you're going to continue to overuse the elbow, or you're going to continue to overuse the TMJ, then you will increase the chronic inflammation to the point where it creates symptoms again. And that is why the protocol includes, after you get this chronic inflammation down to a point using 24/7 for 2 months, then it's nighttime the rest of the patient's life. So all those are factual and known. Again, what is the variable? What is unknown is how established the patient uses the protocol, whether or not they are compliant. Patient compliance is the one variable in treating patients, and the doctors need to be aware of this, and they need to, number one, take the responsibility to continue to educate their patients. All that we can do is educate. We can take them to the water, but we can't make them drink. But we can educate. We can take them to the water. We can we can be patient about it. Not lose our own temper with someone who just refuses to do what is in their best interest. I see it all the time. But patients do want relief, but it is our responsibility to educate. But it is also our responsibility to make sure the treatment goes right, because ultimately, when it doesn't, the patient wants to blame the provider or the device. And we know the providers know what to do, and at least hopefully they know what to do. And we know the device works when used according to the protocol. So again, it all boils down to patient compliance. And so we must take our time, use our patience, use our goodwill and our logic to make sure the patients understand the importance of the proper protocol and use of the protocol. And when they don't, then put the responsibility on the patient. Don't take that responsibility. If you've done your job and you've done it well, then don't take responsibility for something that is not yours. It's the patient's responsibility to perform the proper compliance. And if those pieces are put together, if those 4 things are put together, which is know the cause, chronic inflammation, use the proper clinical procedure, device, and third, the proper protocol, and fourth, obtaining successful patient compliance, treatment for TMD is easy. It is easy. It is predictable. And frankly, it's a lot of fun because the patients are very, very grateful when you get them out of 20 or 30 years of cyclical symptoms of chronic and continuous headache, earache, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of locking. It is not important that you treat the X-ray. It is not important how much damage is already done to the joint. Yes, it is damaged. That damage is not going to repair itself. You're not going to see a change in the X-ray over time. But what will happen is the chronic inflammation will diminish, even in a very damaged temporomandibular joint, whether the disc is dislocated, whether there's a hole in it, worn in it, whether you have subchondral cysts, whether you have degenerative change of the condylar head to the nth degree, whether it looks like a hockey stick, makes no difference if you can make the chronic inflammation go away. Treating TMD is easy when you know the cause and you remove all of the variables, which in our case is getting the patient to follow the protocol and perform good patient compliance. I think that sums it up, and I think this is kind of a summary. If you need or want to go back into the specifics of how this came to be, or exactly how chronic inflammation drives all the symptoms, which is an important feature of our course that we offer on how to do this, go back on some of the previous episodes. They're titled extremely well, so you can pull out the episode that applies. If you'd like to become a network provider, you can do that by taking either our online course or our in-person seminar, which our next seminar is offered here in Cool Springs, Franklin, Tennessee, November 1st, 2024. There will be a seminar offered about every quarter. But you can take the course in person, you can take the course online, which allows you to become a network provider of our patented, FDA-cleared, university-studied device. And then you can apply it to all the patients that you have in your neighborhood. So next time we'll pick out another topic that hopefully will encourage you or enlighten you as to why temporomandibular joint problems is not the onus that it has been thought to be before. It is not complicated. You don't have to use smoke and mirrors. It is actually very easy. Until the next time, when we speak, I can be reached at Tony and tmjservices.net. Our website is www.urbanekdvice.com. Until the next time that we speak, I am Tony Urbanek, and this is TMD Demystified, and I appreciate you viewing this very much.